If a patient presents with vomiting and diarrhea and medical management has failed and survey radiographs are inconclusive, a contrast study may need to be indicated. X-rays are taken at intervals to evaluate changes in morphology, the rate of gastric emptying, and small bowel transit time. At my clinic, we do an initial set of survey radiographs, a set after administration of barium, a set again at 15 minutes, 30 minutes, 1 hour, and then again at 2 hours. This set includes both lateral and VD views. Again, you would measure using calipers to get the size to determine your KVP. Again, remember Sante's rule of 2 times the caliper measurement plus 40, and then select the appropriate MAS for that KVP. At my clinic, we do use digital X-ray, so our settings are determined based on the animal's weight. When taking abdominal X-rays, place the caliper at the edge of the 13th rib. You also want to make sure that you columnate appropriately to minimize the amount of scatter radiation. You also want to remember to wear your personal protective equipment. That includes the use of gloves, your gown, your dosimeter badge, and you also want to make sure that you lean away from the primary beam and do not look at the primary beam when taking the X-ray. When taking the X-ray for the VD, you want to place the cat on their back and extend their front legs cranially and pull their back legs caudally. Again, you want to have the center of the X-ray beam at approximately the 13th rib to get a good diagnostic view of the abdomen. Some doctors prefer that an enema be administered to evacuate the colon before beginning the GI study. When giving an enema, make sure to lubricate the red tube for easier placement and comfort for the animal. Place the tube about 2/3 of the way into the rectum and slowly squeeze from the syringe. Our enema is simply water mixed with a tiny bit of soap. After about 2 hours after the patient has received the enema, it is time to administer the barium solution. The dose for barium is 5 to 8 milliliters per kilogram. This patient weighs 13 pounds, so using 4 milliliters per kilogram, she would receive 23.6 milliliters. Care needs to be taken to keep the pet clean, so we use a makeshift bib and wrap it around the animal. The barium is administered slowly by placing the syringe in the buccal pouch of the animal's mouth. Once all the barium has been administered, immediately take the animal back to X-ray for the first set of X-rays after contrast administration.